How to improve your eGFR, that is estimated glomerular filtration rate. That is how to improve your kidney function. Now, in this video, we'll be talking about what eGFR means, what makes your eGFR low, that is what makes your kidney function low. We're going to be talking about how to improve your kidney function or how to improve your eGFR. Then we're going to talk about probably some questions that you'll be dropping on the comment section. My name is Nurse Mary. I'm a nephrology nurse. Basically, dialysis kidney is my specialty. If you have questions, put them in the comment section. And this is your first time, please subscribe to this channel and put on your notification button, because we don't talk only about kidneys. We talk about women's health, general health, and everything you need to know about your health. Okay, let's get to it. Now, what is eGFR? eGFR means estimated glomerular filtration rate. This simply means the amount of time, the total functionality of your kidney. Now, eGFR ranges from, the normal eGFR ranges from 90 upwards. Some may have 90 to 120, 130. Okay, this is normal. Now, eGFR that is less than 90 means that something is already going on with the kidneys. I'm going to explain to you what may affect your eGFR, because sometimes it's not only when your eGFR is low that it means that you have kidney failure. Okay, now there are stages of kidney disease. This is very, very important in this video. Now, if your eGFR is more than 90, this is okay. The first stage of kidney failure is when your eGFR is more than 90, is 90 or more than, with symptoms of kidney failure like protein in your urine, your blood test, your kidney function test is deranged. That is, your creatinine is high, your urea is high, your potassium is deranged. So these are, of course, foamy urine and swelling and all of those things. You may be having these symptoms that your kidneys are failing, but your eGFR is like 90 or even higher than 90. Please don't say that because my eGFR is high, it means that this is just a normal symptom. No, please go and get checked, because you may still be having the first stage of CKD. It's a gradual process. Okay, so first stage of kidney failure is eGFR more than eGFR that is 90 or more than, with symptoms that suggest chronic kidney failure, which I have mentioned. Of course, if you're diabetic as well, and if you're hypertensive as well. Now, please, I want to let you know that there's what we call hyperfiltration. This is also a symptom that something is going on in your kidneys. Your eGFR is like 150, high. Something may be happening. Okay, if your eGFR is so much high, get yourself evaluated. Let your nephrologist know, so they be sure that nothing is going on. Okay, so second stage of loss of kidney function, that is reduction of eGFR, is when your eGFR is from 60 to 89. This is the second stage of kidney failure, and it is mild loss of kidney failure, mild loss of kidney function. So 60 to 89, second stage, mild loss of kidney function. The third stage is mild. The third stage of kidney loss of kidney function, that's eGFR that is 45 to 59, I beg your pardon, is mild to moderate loss of kidney function. 45 to 59, please be aware of this. If you do your kidney function test and it is 49 to 55, 45 to 59, please, this is mild to moderate loss of your kidney function. Now, the fourth stage of kidney failure is 30 to 44, which is mild to moderate, which is moderate to severe loss of kidney function. This is the fourth stage of kidney. So you do your eGFR and they tell you your eGFR is 30 to 44. This is moderate to severe loss of kidney function. Now the fifth stage, sorry, this is the fourth stage that I mentioned. The one I mentioned earlier is the they call it 3B. They have 3A and they have 3B. Now this is the fourth stage. The fourth stage of loss of function of your kidney, which is GFR, that is 15 to 29, is severe loss of kidney function. eGFR, that is 15 to 29, is severe loss of kidney function. That is the fourth stage. Now the final stage, which is of course when you go to dialysis. Some people that are stage 4 may go to dialysis, but if you manage yourself, of course, with lifestyle modification, it's still delay. All these stages that I'm mentioning, you're not yet to go to dialysis around stage 4 or stage 5. Okay, that's when you go, depending on your clinical manifestation, your urea and creatinine, your urea and creatinine clearance rates, the amount of toxin, how good your kidney is also working, the symptoms. Okay, that will be best discussed with your nephrologist. Okay. So the final stage, which is usually the stage that people go to do dialysis, start dialysis, is the final stage, which is the fifth stage of chronic kidney failure. eGFR less than 15. eGFR less than 15 is when the person now goes to start dialysis. Okay, and this is the last stage of kidney function. Now, very important in this video, you can delay the kidney, delay yourself from entering dialysis. You can delay the progression of kidney failure, which is the importance of this video, and that is what brought us to that, how to increase your eGFR. eGFR, it means how to, if let's say your eGFR is probably on around maybe 70, okay, how do you stop further damage? How? Because if your eGFR is like 90 or 89, gradually it's coming down from 89, 70, 60 until the last stage of kidney failure, of course, which you stop dialysis. So the purpose of this video is to let you understand how do you now increase your eGFR, if possible, or prevent further damage of your kidney, so that if it is your eGFR is 60, it will remain 60 for a very long time, or the rate at which it is reducing will be very slow, so that before you enter dialysis or kidney transplant, you must have lived the entire part of your life, achieve whatever you want to achieve, delay you for kidney, delay further progression of kidney failure, and of course dialysis, and of course transplant. That is the purpose of this video. Now, having understand the fact of the stages of chronic kidney failure or the stages of eGFR deterioration, now let's go to what makes your eGFR to be low. Very important. Now, it is important that it is not every time that your eGFR is low means that you're doing something wrong. Okay, eGFR, that's your overall kidney function, reduces as you age. As you age, it reduces because of course the kidney has been taking you up. So as you age 60 and all, it's not drastic, reduces. Now, apart from that, obesity can also decline your eGFR. Lifestyle, like if you've had a lot of weight and you don't lifestyle mode, you're always indoors, you don't work out, you don't do anything, this will impair your kidneys. So obesity, sedentary lifestyle, this can impair your eGFR, means the totality of how your kidneys function. Now, having known that obesity and sedentary lifestyle, not doing anything, can impair the overall function of your kidneys, the next thing that can do this is diabetes. When you don't manage your blood pressure, your sugar level very well, it impairs on the filtering system of the kidneys and affects you. Same thing, this will now cause protein, albumin, to leak through your urine, causing your urine to be foamy all of the time. I've explained to us how to cure treatment of foamy urine. I'll put the link to the video on the description box so you can watch them. The next thing is, of course, high blood pressure unmanaged. This will now continue to, narrow the blood vessels. Okay, it will narrow the blood vessels of your kidneys and causing more pressure on the kidneys and increasing also more pressure, causing more pressure on the kidneys, causing more pressure on your heart. Blood pressure is also increasing, kidney pressure increasing, kidney damage increasing. So please manage your blood pressure very well. We'll have videos here, a lot, that will help you. I'll put the link on the description box as well. If you want to have a consultation with me, a nephrologist, a renal dietitian, a urologist, we'll have them on ground. Okay, you just book a consultation via the number that is on the screen. It's a paid consultation, and to get this specialist is quite difficult because there are a lot of quacks out there. Okay, so the next thing is like I said, old age, which is over the age of 60 years. As you age over the age of 60 years, your kidney function starts deteriorating, but not so fast. Very important is if you have a family history of chronic kidney failure, this can cause this to happen as well. And so when this is happening, is best that you're very careful. Example, if you have a family history of PKD, polycystic kidney disease. So if you have kidney PKD, your child will have PKD as well. So, and some other health conditions like inflammatory conditions of the kidneys like glomerular nephritis, interstitial nephritis, and some other things. Now another thing is the kind of burden that you exert on your kidneys can make your eGFR to be low, which is taking anti-inflammatory drugs like ibuprofen, diclofenac, abusing them, even acetaminophen, which is paracetamol. If abusing them can damage your kidneys. So I advise, don't treat symptoms, treat the cause. Okay, you're having a pain and the pain keeps on coming, but when you take these drugs that the chemist missed for you or the pharmacist missed for you, you become okay, and then afterwards it comes back. Especially this kidney back pain, the worst thing you can do when your back is paining you is to take diclofenac, naproxen, or what are they, all those painkillers. It gets worse. Please see a nephrologist or see a urologist so they'll find out what is going on and treat the cause. Okay, because when you take these drugs, it damages your kidneys further. It will give you, of course, is a painkiller. It will give you premature relief, but then damages the kidney more. So you may feel this person knows what they are doing because they gave you painkillers and you're feeling okay, but more damage is going on in that kidney. So I suggest that you should have a personal doctor, or a personal nurse. Have a renal nurse. If your kidney have some issues, have a renal nurse, a renal doctor to discuss these things with each time. So if you want me to be your renal nurse or whatever, you want a renal doctor, that you can always constantly, talk to. The link that the number that will be on the screen is a paid, of course. All right, so the next one is overwhelming your kidneys with lot of animal protein. Overwhelming your kidneys. When you eat a lot of protein, especially animal protein, it makes your kidney work times 10. A lot. Please be aware of this. Okay, eat your normal protein, your meat, normal, but not all of the time you eat lot of meat. Is the kidney that is the end product is urea and creatinine. What brings it to the end product of urea and creatinine is the kidney. They are working, they have other things they are doing, so always overwhelming it is not good for that kidney. All right, taking some things like processed food, a lot of sugar, these things will increase the pressure in your heart, and when your pressure in your heart is increased, enough blood does not come to the kidneys, okay, because the kidney receives about, I think, 20% of total blood flow. It receives a lot of blood, so it needs blood, okay. So mindful of what you take lots of vegetables. Okay, we'll talk that about how to increase your eGFR. So it is better that you know these things, so that when I'm talking about how to increase your eGFR, it is going to be more understandable for you. In fact, without even watching it, you already know what you will eat and what not to eat. All right, so that's it. There are some other things which are not, they are just other things that could cause, that are affecting your kidneys, but they won't like possibly cause your eGFR to reduce immediately. So of course, dehydration is not good for you. You have to drink lots of water, okay, and of course alcohol. So now that you've known the things that are bringing down your eGFR, please, that's abusing of drugs. Please, like non-steroidal anti-inflammatory drugs. There are some other drugs, very important, some herbal remedies, like in Nigeria we'll have abu and some other things. There is this seed that they call nettle seed. I'll talk about that on another video. It is good for the kidneys, however it can damage your kidneys as well. So we'll talk about that on another video. This is just for improving your eGFR. In fact, improving your eGFR, this seed will also be in it, but you just have to also be careful. So having said about it, now how do you improve your eGFR? If you skipped the other part of the video, please go back and watch it, because improving your eGFR depends on the level of what your eGFR is. Okay, this is why we have a systemic plan guide. So for if you notice, if you've come to me for telling me your eGFR is low, when we finally get you a renal dietitian, we use your results to check your eGFR, because what you avoid in each eGFR, each kidney disease is different. Okay, so number one way of increasing your eGFR, number one thing, of course, is that you have to get yourself a renal dietitian. That is the number one. We have one on ground. You don't need to see. What you need to do is just get us your results, get us your results, your eGFR, all the tests you did. The renal dietitian will prop a meal plan for you, and of course tell you things that you avoid and things that you will do. The number that is on the screen, this number has been on the screen since, so that is the number that you will chat on WhatsApp and tell them probably you want to consult with Nurse Merit. They are going to ask you to pay, and then if you make payments, they will now contact me and then give you the time to call, and then from there I'll take it up to who you will see. All right, so renal dietitian is very, very important. Number two, of course, before the renal dietitian, you should get yourself is a nephrologist that already have told you that this is what is going on. So please, you have to work in hand with a nephrologist, okay? Nephrologist, nurse, nephrology doctor, anyone is good, okay, so that you will not be doing more things that will be harmful to your kidneys. Please, if you're having kidney issues, don't just work with a regular doctor or a regular nurse. Please, this is why it is a specialty. I beg you, I know it's expensive, but try as much as you can, because these people, they specialize and they know better. I know why I'm saying, because a normal doctor is going to, some will just give you some of these drugs that will impair on your kidneys the more. In fact, there are some drugs that will be changed for you. Your diabetic drug, your high blood pressure drugs, that needs to be changed because they may continue to impair on your kidney, so they need to be changed. Okay, all right. So having known about the fact that you need a medical team to help support your kidneys, these are now the things that you have to do. Number one is, please, you have to work out. Exercise helps you a lot. Exercise causes more your heart to pump. Then when your heart pumps a lot, it causes more blood to be directed to the kidneys. So the more blood your kidneys have, the more better it is for you. So you work out at least 3 or 4 times in a day. If you are the one that is now always staying in the inside, please try to work out. Okay, now I don't mean go and kill yourself in the gym. Just treadmill, bike, anything that makes your heart pump. You sweat, even though you may not sweat because of your weather, but you know your heart pumps. This is very, very important for you. It will increase your eGFR. I'm telling you, I have lots of patients that I've treated. Their eGFR, the ones that were 60, someone the eGFR was 60, now is 90. From 90 is 105. I had another one, eGFR was 70, now it is 90 something. I had, you understand. So very, very important. Okay, the next thing to do is depending on the stage, but generally for now you have to reduce your animal protein intake. Like I've mentioned earlier, watch the videos of why your eGFR is reducing. That will help you. Why your eGFR is reducing, that will help you. It is in this video. Just go back in case you just fast forwarded it to the last point, okay, so that you will understand better. Okay, so the next thing is try as much as you can to limit animal protein. Animal protein, like I've explained, it's more stress to your kidneys, more acid. Your kidney has to get rid of a lot of acids in your system, so that so what do you now do at this point? And plant protein is okay. You take a lot of vegetables. Now eat this kind of vegetables: broccoli, cauliflower, kale, any green. They are good for you. Okay, reduce your meat intake, any form of meat for now. You can get your protein from these things, these plants and plant proteins that I mentioned. Nuts, it is good. Now in the aspect of nuts, it now depends on the stage of eGFR. Now if your eGFR is somewhat between stage 4 that I mentioned, even stage 3, nuts will have to be reduced because it has lots of potassium. You see why I said you need a renal dietitian, which will have. So but generally, these are the things that you will eat. Okay, now of course, milk, reduce your milk intake. I wish I have a live section where you people ask me questions and I will answer. I think if you want us to have a YouTube live section, just drop it on the comment section so that I will prepare for that, because sometimes I don't remember these things. It's when I see it on the comment section I remember. So any herbal mixtures, please reduce it. Highly processed food, bread, all of those things. Now fast food, very, very important. Please stop it, because this thing has a lot of hidden sodium in them, even phosphorus. Now drinks like energy drinks, beverages, all those, just your drink right now is water. That is your drink. So once in a while you can do kidney detox. I've told us how to do kidney detox. I'll put the link to kidney detox on the description box. It's about 2-3 different videos. Please watch all of them. Kidney detox will help you. I mentioned the things that you will do. Now there's this thing that they call nettle seed, very important. That nettle seed, some come in nettle tea, some come in fresh and leave. You blend it and dry it, and then some just come in the seed where you blend it and just take a tea. The instruction on how to take it is on the however form you're going to get it. Now that thing helps with your kidney function to go up. Very, very important. Nettle seed help your kidney function to go up, but it depends on the stage of kidney failure that you are in. If you are on already kidney disease, that's your kidney probably stage 3, you don't need to take nettle seed. It is going to cause what is this heart heart failure complications for you, because Nestle seed is also a diuretic. It makes you pee. It tries to restore the acid base balance of your kidney. That is also, which boils down to that acid, which is a lot of meat. So during this process, you are going to be peeing a lot, and peeing a lot, most people don't know that they should take water. As you're peeing a lot, you're not taking water, more problem is going on the kidneys, because the kidneys is not well hydrated. So you see, it's not all the things you see online you're going to take. Each of them has their measures. I think you shouldn't take more than 20 ounces a day, but I don't know the type that you have in wherever you are in. But make sure you follow the instruction, and make sure that before you take any herbal supplements, your doctor knows about it. There's another one that is juniper seed. I'll put a link on these things that I'm mentioning. There are videos on that. I'll put a link. So I don't want this video to start explaining what I've explained in another video. So you will see how to get back your kidney function. I'll put the link on the description box. Is just click on this video. You see a box, that thing that they wrote, the description of this video. When you click more or what, you see links. Just click on those links and you'll be watching different videos that are related to this one. Okay, so that's basically it. Try as much as you can to do those kidney detox. They are there. All those things I mentioned are there. Different things that I mentioned, how to do different things are there. Now, very important, manage your blood pressure. Most of the times is as a result of unmanaged high blood pressure and unmanaged diabetes that damages the vessels of these kidneys. If you can manage these two strictly, where your blood pressure is always normal, your high BP is also your diabetes is always normal, the kidney function will stop deteriorating. Now, we are not really caring about bringing the eGFR up. Of course, it can go up when you do this thing, but further damage has to be stopped, because the further your kidney damages, the more it will finally fail. And then, of course, there's no cure other than dialysis, kidney transplant, and of course, the number one is God. God can heal you if we. All right. So watch videos on diabetes, high blood pressure, how to manage them. I'll put the link. If you want to have a meal plan, how to meal plan, get access to meal plans of this, chat the number that is also on the screen and request for a meal plan. We had a class, but the class has ended. Okay, so or you can also do another class for you if you want us to do another class. All right, so that's it. Remember, working out. Now, the nuts, there are some nuts that are good, but these nuts, they are good, but they have a lot of potassium, so you have to be very careful. Now, if you're on dialysis or you're stage 4 nuts, generally you have to reduce your potassium intake generally, because more potassium, your kidney, the kidney now is, remember, the kidney does acid base balance, which is your the potassium, bicarbonate, all of those components. It tries to balance it works. So when you eat food that are high in these things, it gives it more work. We are trying to allow your kidney to rest so that it will improve more. So potassium, anything that is so acidic, which is meat, animal protein, should at this point be stopped, reduced. Okay, at this point. Now, very important, when your eGFR is low, this is why I mentioned having a contact with your nephrologist that is well seasoned, okay, with experience. Usually when you're diabetic and you're hypertensive, your drugs are going to be changed. There are some kidney protecting drugs that will be prescribed for you. Kidney protecting antihypertensive, because I've already explained to us that antihypertensive drugs can damage your kidneys, so when the kidneys is already having issues, this is why I also mentioned that you have to do those tests that I mentioned every year if you're hypertensive and diabetic. The link will be on the description box. So they will now change your drugs so that the drugs will not further, your kidneys will be protected and no further damages to your kidneys. There are supplements as well you have to take. I've mentioned this. Remember, herbal supplements, herbal mixtures, please stop at this time. I'm begging you. All those things you are seeing online is not true. stop at this time. They may help you improve your kidneys, but when your kidneys is already failing, which is it is weak, giving all these things will make it further weak. Okay, all right, that's all about it. Remember, my name is Nosmet. I'm a nephrology nurse. Like this video. If you don't like this video, my mouth is already paining me, so please just like this video and share if you can. Very soon we'll have a class. We'll have a platform where people that have the kidney failure, that are on dialysis, will have my attention. And that class, you will not chat me. It will just be on, I will send you people videos and questions, just questions. The questions will just be on the platform. That's all. And I'll answer the question. No private chatting, because if you private chat me, you have to pay for my attention. So very soon we'll create that platform where I'll help out, because about 200-300 people chat every day to talk to me every day. So you can imagine how, I have a job. All right, thank you and have a nice day. Bye.